Hi, you're on the air with Kristy. Who's this?
Hi, Kristy. It's Tegan down here in Atlanta. Hi.
Hi, Tegan. How are you?
All right. First off, Dr. Leis, I'm uh, very anxious about facial feminization right now. I'm 6 months full time. I'm on hormones. I don't have a problem getting the first letter from my therapist. I guess you probably take two. You have to have two letters, I guess, to go bottom. Correct?
Right, for the bottom, but I don't require any letters for the face or the chest.
Okay, that's right. Okay, on the face. Uh, we need to go in, I guess, and make a consultation with you? I'm in Atlanta. If you're only a couple hours away, we would make a consultation, I guess, visit to check out what would be needed.
Right, I can give you a little tip. I'd love to see you if you can come up here to Philadelphia for a live consult or meet me at one of the trans meetings that I go to around the country. But another way to do it, because patients come from all over the country, all over the world actually, if you send me some photos of yourself, take some digital photographs and email them to me right at my office, Dr. Sherman Leis at drshermanleis.com. People do it all the time. Send me a good full face front view and a quarter turn to the right, a quarter turn to the left oblique view, and a profile view, exactly side view to the right side and completely to the left side, so that we're just a little bit above and below your face. And then send me your phone number too. I mean, I can write to you back or send me your phone number if you like. I'll call you some evening and we can discuss what I would recommend.
And it's really best if you don't Photoshop your own photos before you send them to you. Is that right?
Don't Photoshop them. No, don't Photoshop them. Just send them to me just the way they are. Just a nice full face view.
Okay, all right, Tegan. So no Photoshopping your pictures before you send them.
Okay, all right. Can I have another question? I've lost about 82 or 83 pounds in the last year, and on this stable diet that I've been on, I would hopefully lose about 20 more to get down to where I'd like to be. As far as facial feminization, would it be best for me to wait until I was completely done with any weight loss program before doing that?
It's not so important if we're modeling your forehead. If we're doing a brow forehead lift, the weight won't matter so much. If we're doing your nose, it won't matter so much. If we're doing upper lip shortening, it won't matter so much. A chin remodeling, the only thing we might not see if you're very heavy, we won't see your Adam's apple if you're very heavy, but if your neck is thin and we can see your Adam's apple, then we can do it. So most of the procedures, one procedure that it would be important would be if you also wanted to do a facelift. I don't know how old you are and if you have jowls or a loose flabby neck, but if you do, you might benefit by a facelift. That has nothing to do with feminization. That has to do with rejuvenation, looking a little younger and fresher and rested. But we don't like to do facelifts on people that are too heavy. You just don't get a good result. Let me ask you a question. How tall are you? Don't tell me your name. Just tell me how tall are you?
How tall am I? I am
Yes.
6'2".
Okay, now, don't tell me how much you weigh, but I'll tell you how much you should weigh. You should weigh about 180, 185. That's about what your weight should be. A little less or a little more. 180, 185, 190. You certainly want to be under 200 pounds. And if you're over that, you really want to keep losing weight. As a matter of fact, if you write to me, send us your email and I'll send you our diet sheet. I don't think of it as a diet, but I've written up a healthy eating program. Just one sheet, basically. If you do what that tells you to do, you'll not only lose weight, but you'll live years longer and you'll be healthier. So that'll give you some tips. It's just a relatively healthy, low fat, low carb, low calorie diet, but you'll never be hungry. You should never skip meals. It just tells you some good tips on how to eat. Someday, if we have time, we can talk about diet and weight loss a little bit too. So how to eat healthy. I follow that healthy eating program myself, and I don't have to lose weight. I just want to keep my arteries open because I'd like to be around a few years longer if I can.
We'd like you around a little more too. Any other questions, Tegan?
Well, millions, but I guess I can let somebody else come on. But yes, that is my target. I'm about 20 pounds away from it, I guess that's. One other quick question. I've been on hormones just 3 months. How long should I wait on top surgery to let that go its course before doing an augmentation? Possibly?
That's a very good question. Very good question.
Yeah, it is a good question. I think at least 6 months to a year. Some people even grow a little bit after a year, between 1 and 2 years. But I think most of the growth that you'll see growth within the first 3 or 4 months. But I would let it go at least 6 months to a year before you think about surgical breast augmentation, because you might be pleasantly surprised. Most trans girls develop an A cup, but occasionally I see a B or a C cup. So I'd give it 6 months to a year, maybe about a year or a little bit longer before you do a surgical breast augmentation.
We may very well fly up there and fly back in bandages someday.
Okay.
Good for you, Tegan. Good for you.
When you go home, you won't have any bandages, though, by the time you go home. Oh, you were starting to ask, when people do come for surgery, if they're doing facial surgery or breast surgery, they can usually go a little over a week. If they stay here 7, 8 days, they can usually go home. When they come for bottom surgery, we like them to stay in the Philadelphia area about 2 weeks. They're 3 nights in the hospital. F to M is 3 nights in the hospital. M to F sometimes only 1 night in the hospital. But F to M gals stay about 3 nights in the hospital, about another 11, 12 days here. So they're in Philadelphia about 2 weeks altogether. Then it's pretty safe to go. We take out the Foley catheter out of the bladder and the vaginal packing out in 1 week. And then during that second week, we show them how to dilate, give them a set of dilators, and they get used to that and heal up a little bit more over that second week. And then usually by the end of the second week or a little bit less, then it's usually pretty safe to go home.
How's that,
Okay.
Tegan?
All right, so I'll let you go. Doctor, I have a feeling I'll probably be showing up in your office sooner or later here to at least to get this car wreck of a face fixed, okay? Thank you so
Okay,
much.
we'd love to see you.
Thank you. Thank you, Tegan. Thanks for calling.
Thank you. Thank you.
Okay, so that tells me I need to find a babysitter for my cat for at least 2 weeks for you, okay? So I'm already planning on that.
Yeah, from surgery, facial and chest surgery, a little over 1 week.
You talked about the brow reduction on the FFS. What is your procedure that you use for the brow reduction?
I've been trained in craniofacial surgery. Dr. Alsterhood and I actually trained together in Paris about 35, 40 years ago. But I have a different philosophy than my friend Doug. He likes to do everything he can do on everybody's face, and I don't believe that that's necessary. He likes to take, for example, to model the forehead. He thinks everybody has to have their whole frontal bone taken off, remodeled, and plated and screwed and bolted back on again. I don't believe that's true for about at least 9 out of 10 people, or I would say even 99% of people don't need that. Only if you have a forehead like a Neanderthal man, that it's tilted so far back that and your brows are so far out that you really look like a caveman. If you don't look like a caveman, then you don't need to have your brain exposed and your skull opened up like that. I like to burn down the frontal bone bossi, the heavy brow bones that people call it. It's the lower part of your frontal bone, the inner part of your supraorbital rims, the bone just above your brows. We make an incision at the hairline. Or if you don't have a hairline, if you have no hair at all, we could just make an incision anywhere. But then it doesn't matter if you wear a hairpiece, but pretty much where a normal hairline would be. We lift up the skin off the frontal bone and down to where the brows are. If you have bony prominences that we call bossi, 2 bumps at the lower part of your forehead, we burr them down.
Which is what I had, yeah.
The supraorbital rims are prominent, we burr them down. And we know exactly how far to go, because when you start to get thinner and thinner, where you're getting close to the sinuses, the frontal sinuses right there, the color of the bone starts to get a little darker because there's air getting close. So we stop, and then we know we're safe. And I've done hundreds of them, and we've never had a problem. Then we just elevate. Oh, and if someone's a little bit older and they have some frown lines and horizontal wrinkles on their forehead, we resect those little corrugator muscles that cause the frown lines. We resect a little strip of the frontalis muscle, and that takes away those wrinkles forever. You'll never need Botox. That's just a little side thing we do for people that are getting a little wrinkly or a little bit older.
That's very cool.
And then we just elevate the brows. We pull that skin up, elevate the brows, and we resect. We cut away, we excise maybe a half an inch, maybe an inch of the forehead. And then we resuture it. Now, if we want to advance the hairline, we also undermine or lift up the scalp, the hair-bearing scalp, so we can advance that downward. And we bring that down so that I'm not a good example because I don't have any hair on the top of my head. But if I made an incision where the hairline should be, I can move that down maybe half an inch, maybe an inch. It can't get much more than 3/4 of an inch or an inch in anterior hairline advancement. We can't get the brows up 1/4 of an inch, 1/2 an inch, sometimes more. But if you raise the brows up 1/2 an inch or 3/4 of an inch, and you raise the hairline down 1/2 an inch or 3/4 of an inch, you've reduced the height of the forehead maybe 20–25%.
Yep.
Sometimes more, sometimes a third.
Yeah.
And it makes a dramatic difference. When we raise the brows, it not only makes the face look more feminine, but it shows your upper eyelid more. There's more skin showing between your brow and your upper eyelid. And if your upper eyelids are a little droopy, it corrects that. So we don't have to do upper eyelid cosmetic surgery. We don't have to do what we call a blepharoplasty. It gives a very nice freshening and feminization of the face. And it refreshes and turns back the clock a few years at the same time. Sometimes we'll do the lower eyelids too. If someone has bags or puffy bags or circles on their eyelids, we fix them at the same time. That's not a feminization procedure. That's a rejuvenation procedure. And it works very nice.
It's very, very nice. That's what I had done in October of 2009. And my scar is not yet gone away. I wish it would.
Well, it will never go away. It will never go away. Scars are permanent, but it takes about a year for them to mature. And they're pink in the beginning, and somewhere around between 6 months and a year, certainly by about a year, a little more, a little less, the scar usually becomes just a little white fine line. It's always there, but it's not too noticeable. And I always tell my girls to wear their hair down a little bit like you do. That's a smart way to wear their hair down. You can have either bangs or just parted to one side a little or another side a little bit or in the middle or a couple curls. There are dozens of different hairdos you can do. Just have at least a little bit of hair on your forehead, and you'll never see that scar at all.
There's a reason Kristy has bangs, and that's the reason. So
well, that's a good reason. That's all right. It's a smart hairdo. And the little bit of hair on your forehead actually gives the appearance of an even shorter forehead, so it's even more feminizing.
Well, thank you.
So hairstyle is very important. As a matter of fact, when I give my talks at the trans meetings around the country, and I give them at all the major trans meetings, I have 1 hour-and-a-half presentation on just facial feminization. And I always tell my audience that I'm a surgeon. I make a nice living doing surgery. I send my kids to school and pay my bills and my mortgage because of the surgery I do. So I like to do surgery. I like to make money like everybody. But I'm very honest and very blunt. And I tell people the most important part of feminizing your face and your body, as a matter of fact, the most important part of transitioning is not surgery at all. It's grooming.
Oh, okay.
Grooming. It's appropriate grooming is so important. And of course, acting appropriately too. But grooming is so important. You know, very few of us have perfect features. But even if you had absolutely perfect features of your face and your body, but if you walk in with a 3-day beard because you never got around to doing electrolysis or laser hair removal, and you don't even bother shaving but once a week, and your hair is short and messy, and you're wearing guy clothes,
and you got a unibrow,
smoking a cigar maybe, or wearing overalls or some ridiculous outfit, sitting with your legs apart. I mean, I don't care what your features are, you're not going to look feminine, you're going to look horrible. But even if you have much less than perfect features, and most of us have less than perfect features, if you groom yourself well, you can be very attractive.
Not only that,
attractive. So smart and appropriate grooming, to me, is the single most important part of transitioning.
Not only that, but a little bit of confidence as well.